All right, welcome everybody to the next edition of the Beyond the Blade podcast. This is a great one. I'm really excited about it, and it's what happens when surgery goes wrong. So everybody always wants to know if something were to happen to me, either during the surgery, right after the surgery, what happens? What do we do? How do we help people at Zuri Plastic Surgery? How do we make them feel comfortable when they're going, or help them feel comfortable when they're going through this very stressful, anxiety provoking, very exciting, obviously, situation. But what is it that we can do to help people? So the point of the podcast today is to talk about a few things that I think really make the difference when you come to Zuri Plastic Surgery. So one of them is, how close is the hospital to the surgical facility where you're having your operation done? All right. That's good research to do. Okay. Highly recommend it. Get on Google. All right. Put the address of the establishment where you're going to have surgery. All right. And then Google the nearest hospital. How close is it going to be? Because in all honesty, if there was a serious emergency, either during or right after, or in the immediate recovery phase, any clinic is going to be required, or any surgical practice is going to be required to call 911. And the paramedics are going to arrive relatively quickly. And in most cities, it's between about a 4 to 5 minute arrival time for the most part. And then you're off. Then you've gotten picked up and you're heading to the nearest hospital. Now, how far is that going to be? Because when it comes to surgical emergencies, or post-surgical or intraoperative emergencies, every single minute counts. Okay, you don't want to waste any time, because time is tissue. And we say that as surgeons and as doctors, because this is analogous to if you had a heart attack or a stroke. Every minute that you don't get blood supply to a specific area, which, for example, your heart, more of that heart tissue is going to die, and then more long-term problems you're going to have with your heart functioning in the future, or maybe not even surviving the heart attack. So nowadays, in all 50 states in the country and across the world, they have stroke teams, heart attack teams, that when they get an alert, everybody comes to the emergency room on that particular team to immediately take care of the patient. So when you come to Zuri Plastic Surgery, the hospital is across the street. Literally, I can open up my window in my office, and if I throw a rock hard enough, I'm going to hit the hospital. There's no question. It's literally walking distance. I walk to the hospital whenever I have surgeries that I do there for particular types of cases or particular patients. I literally just walk out the front door of my office and cross the street, and I'm in South Miami Hospital. South Miami Hospital is part of what I think is the premier hospital system in South Florida, which is Baptist Health System. Okay, and it's very important. When surgery goes wrong, does your surgeon have hospital privileges? Okay, and where does he have hospital privileges? Okay, because if you get transported to a hospital that is 10 miles away from the clinic, and for whatever reason, the surgeon who operated on you doesn't have privileges at that hospital that you were transferred to, then you're going to be basically at the mercy of whatever surgeon or whatever team is going to take care of you when you arrive. They are not going to be able, the surgeon's not going to be able to go in there and to see you, because he does not have privileges. Therefore, he cannot dictate your care, and that's a very difficult scenario for for you as a patient. It's very nerve-wracking. It's very anxiety-provoking, because the person who you got to know throughout the consultation experience and the surgical experience is now unable to take care of you. So that does not happen at Zuri Plastic Surgery. I have hospital privileges not only in South Miami Hospital, but also what we call the mothership, or the big hospital attached, to South Miami in that system down the road, which is called Baptist Hospital. And I have hospital privileges at both. I'm also on the on-call staff for Baptist Hospital, and I go in there and I take care of patients in the emergency room, and I take care of patients from other plastic surgeons who have patients that have complications. And I'm happy to do that and provide that service. But anyways, that's really important. When surgery goes wrong, okay, does your surgeon have hospital privileges? Where does he have them? And how close is the nearest hospital to the clinic? Okay, that makes a huge impact in potential survivability or decreasing morbidity, decreasing complications related to whatever happened that went wrong. Okay, when we talk about things going wrong in general, again, in plastic surgery, you've heard me say this before in other podcasts, less than 2 to 3% chance that anything is going to go seriously wrong, that would require, being transferred to the hospital. Knock on wood, in my practice, I have not had to transfer anybody to the hospital, okay, from my practice, from my surgical facility, at any point since we've started practicing. And so I'm very fortunate in that. But it's not only fortune, it's also planning, being very meticulous, and exercising extreme caution when taking care of patients, and also selecting the appropriate patients. We have a lot of patients that call the practice and send in their photos and come in for in-person consultations and all of that. And sometimes I think to myself, do they not realize that this is a very dangerous situation for them because of all of their medical problems? Do they really think that they're going to have a safe surgery when they have, a prior heart attack, a prior stroke, a cardiac stent in their past? When they've had, insulin-dependent diabetes for 20 years, and, they have, all kinds of problems related to the diabetes, and, their hemoglobin A1C level, their labs, for their diabetes are off the charts, and they have terribly controlled blood pressure, they're obese, or, so, you have to select the appropriate patients as a surgeon. And, there will be always patients that are going to try to push the envelope and that are not going to be good candidates, that are going to get offended a lot of times, or they're going to get upset or hurt, when they get told, hey, listen, I don't really think surgery is right for you. I don't think that this is a good idea. And I think that maybe you should get into weight loss or exercise or something else. So just keep that in mind. That's how we prevent things from going wrong, is that in my practice, we have all of our patients go through a very, very specific medical clearance process. And I cannot clear you alone as a surgeon. I need a team of other doctors. So our anesthesia providers make sure that they clear you properly. All the primary care colleagues that we have in the community, they make sure that you're healthy enough for general anesthesia and that you're capable of undergoing a procedure. And then a lot of times I have to get subspecialty doctors involved. So, if you've had a lot of, diabetes issues in the past or thyroid problems, I will send you to an endocrinologist to make sure that they sign off that you're ready to go. A pulmonologist if you have, sleep apnea issues, or a lot of different subspecialty doctors to make sure that you're ready to go. So at the end of the day, it's all about prevention. We want to prevent patients from having complications, and one of the important ways to do that is to get the appropriate medical clearances. I know as a doctor that this is not fun. Okay, it's really the fun part about plastic surgery is, the excitement and jumping in and, doing the surgery and coming out of it and feeling great and looking great and, all of that. But, part of the issue is that, it cannot always happen like that. You have to jump through a lot of certain hoops before we get into surgery to make sure that it's a possibility for you and that it's going to be safe. The other things that, you want to make sure if things go wrong is, what about your insurance? Like, is there any insurance that was offered to you? Is there any possibility for insurance that you can use to be able to help you in case something were to happen? So that is what we offer at our practice. It's called Aesthetisure, and Aesthetisure helps to insure your surgery. It helps to, come in financially if there were a problem. And so Aesthetisure is a one-time $250 fee, and they basically come in to help you out and do anything that they can financially to back up a hospital visit, an ER visit, or any other repeat surgery within the first 6 weeks of your operation. Again, why wouldn't you do something like this for only $250? And that's a benefit of Zuri Plastic Surgery, that we can help you by offering you this national insurance company that can help you in case something were to happen. So, in summary, when things go wrong, what we do is we follow the protocols that are established by Quad ASF. And Quad ASF is our nationally accrediting facility, nationally accrediting agency for our facility. And they are the ones that, come in, inspect us, and make sure that if there were to be an issue, that we know exactly what to do. We also do a lot of team drills in our practice. We do anesthesia drills, we do recovery drills. We go over our protocols as a team. And we also take group classes together, like advanced cardiac life support, pediatric advanced life support, basic life support as a team. And that's very critical in ensuring that if something were to go wrong, everybody on the team is able to help and has the knowledge to help. And that's very important. So if you have any other questions about safety, about what if something were to go wrong, please reach out to the practice. All of our staff is educated in answering these types of questions, and I'm happy to speak with you about it as well. Thank you so much for joining this episode of the podcast, and we hope to see you soon.